Welcome back to A World Without Malaria. Previously, in Chapter 4, we spoke about uncomplicated malaria and how it affects the human body. But in this session, we'll look at severe malaria. Severe malaria is a name used to describe malaria that's so serious that it's an immediate threat to a person's life. The Bible teaches us that we are wonderfully made, and this chapter will really leave you in awe at how amazing our bodies are. Although unfortunately, we'll also see how the malaria parasite can quickly damage how our body functions, even to the point of death. We'll investigate severe malaria in two parts. The first being medically diagnosed severe malaria, and the second being how malaria can have other serious effects on the body, potentially causing life-threatening repercussions. As you watch the video, again, I also encourage you to consult your manual. It contains more details and, of course, take notes. If you haven't seen Chapter 4, Uncomplicated Malaria, perhaps stop here and watch it first and then return. Enjoy.
Hi, my name is Stuart. It's good to be together again. Let's talk about malaria. It is crucial to understand that malaria has the potential to quickly become severe, even life-threatening. It does so by impacting the major organs in your body. Medically diagnosed severe malaria occurs when a massive number of malaria parasites overwhelm your body's systems, causing harm to major organs like the brain, liver, kidneys, and spleen. While Plasmodium falciparum, PF, is the primary cause of medically diagnosed severe malaria, it's essential to note that Plasmodium vivax, PV, Plasmodium ovale, PO, and Plasmodium knowlesi, PK, can also lead to symptoms of severe malaria, which in some cases can be fatal. Individuals diagnosed with severe malaria will experience the symptoms discussed in Chapter 4. However, the conditions we are about to explore are indications that the disease has become complicated, affecting the major organs in your body. So, let's begin this important journey of understanding. I'm going to try and keep this clear, but we all recognize that the human body is complex, and so these explanations are a little limited. One of the key signs of severe malaria is an alarmingly high fever, leaving the person feeling very unwell. Severe malaria can also affect the mind, causing confusion or even unconsciousness. It is a race against time. Seizures can occur, which is where the body shakes uncontrollably, adding to the urgency of the situation. Patients may experience prostration, which is a severe weakness that makes it impossible to sit up without assistance. Or they may have posturing, which is when their body gets stiff. Often, their arms and legs are awkwardly bent and their fists are clenched, and they can move normally. Breathing can become extremely difficult and is called respiratory distress. Watch out for jaundice. This is a condition where the skin and the whites of the eyes turn yellow due to liver issues. Hypoglycemia can occur, leading to shakiness, confusion, and even loss of consciousness. Metabolic acidosis may also develop, and amongst other things cause rapid, deep breathing, making it tough for the patient to catch their breath. Kidney dysfunction is another serious complication of severe malaria, leading to decreased urine output or even complete kidney failure. Abnormal bleeding and clotting can also be a part of this complex picture. In some cases, fluid builds up in the lungs, a condition known as pulmonary edema, making breathing incredibly difficult for the patient. We have spoken at length in Chapter 5 about severe anemia, which is another complication. Severe malaria advances quickly, so if you or someone you know experience these symptoms, seek medical help immediately. Early intervention can save lives. Okay, PF malaria is different from other forms of malaria because not only can it destroy red blood cells, but it also makes some of the red cells it invades sticky. It also changes the shape of the cell. This makes it very hard for the infected cell to pass through the microcirculation system of the body. To help you understand why PF malaria is so dangerous, let me describe microcirculation and microvessels to you in this way. One of the main purposes of the blood is to pick up oxygen from our lungs and carry it to all the cells throughout our entire body. As the blood delivers oxygen to each cell, it also picks up any waste products in those cells, such as carbon dioxide. The blood carries the carbon dioxide back to the lungs, where it is exhaled in our breath, and the process continues. For this work, the human body has blood vessels that transport the blood in many sizes. We have large blood vessels which tend to be closer to the heart, and also very fine blood vessels or microvessels in other parts of the body that are farther away from the heart or deep inside the major organs. If you look in the mirror, you will see that there are fine blood vessels in the white portion of your eye. They are part of your microcirculation system. There are the small blood vessels that carry the red blood cells into your eye. In the same way, other microvessels carry the blood deep into other parts of your body. As I said earlier, with PF malaria, the red blood cells become sticky or misshapen and won't fit through the tiny blood vessels. The blood vessels become clogged, and the tissues or cells they are serving do not receive the oxygen needed in order to stay alive. Where cells have no oxygen, they die. Because of this, PF malaria can quickly become fatal. Okay, now what about the brain and cerebral malaria? One of the most common complications of PF malaria is cerebral malaria. Once the microcirculation system in the brain is blocked, the patient becomes unconscious. This is called a coma. The longer cerebral malaria goes untreated, the worse it gets, and more damage is done to the brain. The symptoms of cerebral malaria are these: impaired or altered consciousness, they will have repeated convulsions or seizures. Posturing and prostration are also signs of cerebral malaria. They may fall into a coma. They will have low blood pressure and a non-specific fever. That is, the cause of the fever is not because of one specific symptom. A person with cerebral malaria will also be showing the other symptoms of malaria mentioned in Chapter 4, such as anemia. Cerebral malaria can be fatal if not treated. The right medication for cerebral malaria will help to unclog the microcirculation system in the brain and assist with better blood flow. A person suffering from cerebral malaria needs urgent medical attention. Next, let's look at liver complications. The liver is the largest internal organ in our body and filters all of our blood and breaks down toxic substances such as alcohol and drugs. The liver produces bile, a fluid that helps digest fat and carry away waste. The liver also produces and stores the glucose our body needs to survive. The liver serves as the primary breeding ground for malaria parasites when they first enter the human body and before they move into the bloodstream. Malaria seriously affects the function of the liver and reduces its ability to make glucose and filter the substances that are going into the body. The sticky blood cells can also produce a complication called malarial hepatitis, which is another dangerous complication of malaria. Jaundice can be a key sign of malarial hepatitis and is caused by there being too much of a waste product called bilirubin in the blood. Jaundice has an intense yellow color that makes the eye white look yellow, and even the skin can have a yellowish tint. Malarial hepatitis, like cerebral malaria, is a medical emergency and must be treated immediately, otherwise the patient can die. The right medications will successfully treat the condition. However, even if the patient recovers, the liver can be permanently damaged if the condition is not treated immediately. Now, let's think about the kidneys. Our kidneys are bean-shaped organs that are located in the middle of our back against the back muscles, with one on either side of the spine. They are one of the filters of the blood. Each day, they sieve the waste and extract the water that is found in the blood and begin the process of sending it out of the body in the form of urine. By the sheer overload of affected blood cells, malaria can cause the kidneys to fail, and temporary dialysis may be needed to save the patient's life. Malaria can also cause a complication called black water fever, which occurs when large number of red blood cells are destroyed by the P.F. malaria parasites. Each time a red blood cell is destroyed, a small amount of hemoglobin is released directly into the blood vessels. The presence of hemoglobin in the blood damages the kidneys as it passes through and causes it to stop working. The hemoglobin that passes through the kidney as urine turns urine a dark reddish-black color, giving the complication its name, black water fever. Black water fever can be fatal. If a person is suspected of having black water fever, they will need urgent medical care. These complications of malaria are very dangerous, and the patient must be attended to as quickly as possible. We will discuss how to assess if a patient has malaria in more detail in other parts of this series. But in cases of significant stress to the body like this, it is important to seek out medical help as soon as possible. Medications can save someone with malaria that is attacking the organs of the body, but quick treatment is essential. We will continue looking at how malaria attacks the major organs of the body in the next section. But for now, I encourage you to pause for a few moments to read through Chapter 8 in order to refresh your memory and prepare for more learning about this important subject. See you when you have finished your revision. Welcome back. In our last section, we talked about medically diagnosed severe malaria, and we talked about how a severe malaria infection can affect the brain, liver, and kidneys. But now, we are going to talk about how malaria affects the other organs of the body. Let's look at the lungs. Your lungs are the pair of spongy, pinkish, gray organs in your chest that process the air that enters and leaves your body. Severe malaria can cause fluid to gather in the lungs. This can happen in a couple of ways. The first way fluid can get to the lungs is when the sticky PF-infected red blood cells block blood vessels in the lungs. This causes pressure on the blood vessels, which in turn forces clear fluid out of the blood and into the lungs. When this happens, the medical term used to describe it is pulmonary edema. Fluid might also build up in the lungs if the kidneys fail and are no longer filtering the excess of water from the blood. The presence of fluid in the lungs makes it hard for the patient to breathe, and they may have shortness of breath and find it hard to breathe if they are lying down. They may also have chest pain, rapid shallow breathing, gasping and wheezing, fatigue, coughing, a fast heart rate, or low blood pressure. They may appear confused and be extremely tired. They are likely to be very weak. Severe malaria can lead to acute respiratory distress syndrome, which is a life-threatening condition characterized by the sudden failure of the respiratory system, also resulting in severe breathing difficulties and low oxygen levels in the blood. If the symptoms of ARDS and pulmonary edema aren't addressed quickly, the patient will find it increasingly difficult to breathe, and without medical help will likely die. When the patient is placed sitting in an upright position, this slightly stretches the lungs and gives more surface area in the lungs, which makes it easier to breathe. They need to have air, so fanning their face may also help. But most of all, they need urgent medical assistance. When fluid in the lungs causes breathing problems, less oxygen is transferred from the lungs into the blood. With less oxygen in the blood, the other cells in the body become starved of oxygen. The medical term for this is hypoxia. One of the key symptoms of hypoxia is that the skin starts to turn a bluish color. This is often evident around the lips, fingers, and toes. The heart rate will also increase, and so will the patient's blood pressure. The patient will need emergency medicine and oxygen therapy, or at least an increased oxygen supply. If an adequate flow of oxygen can be restored into the blood and transferred around the body, the patient will die. Another serious complication in the blood that can be caused by severe malaria is anemia. Anemia occurs when there are too few red blood cells to take oxygen to other cells in the body. We speak about anemia at length in Chapter 5. But when severe anemia occurs, it can also damage the major organs of the body and even cause death. Another serious complication of malaria is hypoglycemia, which in simple terms is a condition when the blood sugar, glucose, levels in the body are too low. Glucose is produced and stored in the liver and carried around the body by the red blood cells. It is especially important for the brain. Glucose gives your body energy. When malaria attacks the liver, it reduces the number of healthy red blood cells. The body's glucose levels can drop dangerously low. Brain functions such as thinking, memory, and learning are closely linked to glucose levels. When glucose levels drop too low, this can affect brain function and put the patient into a coma. A simple way to treat hypoglycemia is to have the person sit down and eat something sweet, such as candy or drink some fruit juice. Anything that has a high concentration of sugar in it. If a person is in a coma, this treatment will have to be done intravenously. young children and pregnant women are particularly at risk from hypoglycemia. Now, let's look at the spleen. Your spleen is a small organ that sits inside your left rib cage, just above your stomach. In adults, the spleen is about the size of an avocado. The spleen is a filter for the blood. When blood cells are damaged, they are filtered out of the body through the spleen. When the body is under attack from malaria, there are millions of blood cells being destroyed, and the spleen cannot cope with the volume of dead cells it has to process. The result is that the spleen swells and becomes very painful. The spleen can rupture, and the person can bleed to death. Malaria and pregnancy is discussed more fully in Chapter 11, but for now, let me mention that pregnant women can suffer from a form of malaria called placental malaria, where the malaria parasites hide in the placenta and can directly affect the health of the baby. Yes, this is also a medical emergency. I realized that in this chapter we are covering these symptoms and illnesses very quickly, but it is important for you to be able to recognize the symptoms and quickly ensure the patient gets medical help. I mentioned earlier that Plasmodium vivax, Plasmodium knowlesi, and to a lesser extent Plasmodium ovale can also cause severe malaria, but none of these forms of malaria are known to cause cerebral malaria, which is caused by PF malaria. They can, however, cause severe anemia, kidney failure, and pulmonary edema, which leads to the respiratory distress. We also know that PK malaria parasites breed so quickly that PK infections are 3 times more likely to develop into severe malaria than PF. Even though it is rare for Plasmodium malariae, PM, to cause severe malaria, it has been associated with kidney complications in patients who have been infected by it multiple times. As you can see, any type of malaria can have very serious complications, and the need to quickly get the patient to a clinic or doctor is important in order to minimize potentially deadly repercussions. Remember what we said before. Each one of these complications of malaria is a medical emergency on its own right, and medical help is necessary to save the life of the patient. Without proper treatment, severe malaria only gets worse. It is critical that a person suspected to have severe malaria be admitted as soon as possible to a hospital. It is of vital importance that the patient gets immediate treatment with the right medicine as well as good nursing care. Remember that pregnant women, children under 5 years, and the elderly are at higher risk. If a patient is treated with suitable antimalarial medicine and proper care in time, then all the complications of malaria that have been mentioned can be addressed and the patient can recover. However, delayed treatment can lead to lifelong disability if organ damage is extensive. Treatment for severe malaria usually includes the use of artemisinin-based combination therapy, ACT, and in some cases, quinine is injected. Other drugs or treatments will most likely be needed to address particular organ damage and help the patient recover, but we will discuss medications more in Chapter 13. Wow! This has been a big topic with a lot of information. Take time to review your manual, and perhaps you might like to watch this video again to help you remember the important details. the chapters on anemia, medications, malaria in pregnancy, and malaria in children particularly relate to what we have discussed here. So I hope they help you to retain this information. Bye for now. Hasta luego.